Tonight's an educational webinar. It's one that I'm taking from my own graduate school work. The difference between a psychologist and a family therapist will be discussed tonight. This is really what distinguishes our education as family therapists from those that are studying general psychology or clinical psychology. And as with most disciplines, of course, there's overlap in both areas, but this is what distinguishes the family therapy training. And it's important to say that family therapy was a reaction against individual psychology. It was a movement away from that idea that as we started to reduce ideas, concepts, principles, health, pathology down to smaller parts, that we were losing something, right? That systems tell us as much about what's going on inside of an individual that can help us understand both what's going on and how to change it, as understanding smaller and smaller parts. So systems theory talks about the whole, and the kind of famous line from systems theory is the whole is greater than the sum of its parts. And I think you can resonate with that in your family. Think about, for example, when you visit family that you haven't seen for a while, especially around the holidays, and think about the feeling, the influences, the energy that comes up for you, and think about how you respond differently in your family of origin. My wife and I, both being family therapists, have had fun with this concept. When we look at each other around each other's family, when I look around her family, and she around my family, we see a kind of regression to a more primitive state that's so obvious to us and so profound. You can see somebody change back into that 16-year-old kid that was being made fun of by their older brother or sister. So that's the context of this. So it's going to be educational, and then I'm going to talk about its application to you as parents, and of course to what we do here at Evoke Therapy Programs. So it started from clergy, this idea that they wanted to give clergy tangible skills to do their counseling, because a lot of clergy serve that role, and so there was a big movement that came from there. Addiction was another area where family systems, family therapy was built out of this. We became aware early on in our intervention with addiction that the family systems themselves oftentimes maintained addictive behaviors, or supported or enabled it. And then for us to be most effective, not just to intervene, but also to maintain the gains that occurred while somebody was in treatment, that oftentimes we had to intervene at the systemic level. And in many cases, we had to intervene at the systemic level in order to initiate an intervention. That if there were certain ideas, concepts, rules, roles, influences in place, that oftentimes that prevented the addict or the identified patient from needing therapy, or from hitting some kind of bottom. So it came from addiction models. There's the car accident analogy of there may be one person driving the car, but we would think it would be ridiculous if an ambulance or paramedic showed up on the scene and only treated the driver. Everybody in the car has been impacted. And so this idea that we just treat the identified patient, and I think a lot of people in our society, in our culture today, I think they recognize to some extent the value of a family systems approach, but oftentimes, in our experience, they don't put enough energy into it. That it really needs to be a consistent, long-term effort. I think there are a lot of barriers to family members becoming involved, right? Like, it's not my problem. I'm not the one with the symptom. I don't want to be blamed. I didn't cause this. That kind of shame that comes out in those ways. And so it's important for the interventionist, for the treating professional, to have skills at his or her disposal that he can help a family overcome the shame, to join with them, and to pull, to invite, to encourage them into treatment. Oftentimes I talk about this idea of inadvertently reinforcing pattern, structure, behavior that we really don't want to see continue. It happens, right? There's a principle that I'll talk about tonight, which is homeostasis, and that is this energy toward maintaining the status quo. That when there is change in our family, in our system, in our relationships, all of us, even having the best of intentions at our core, are going to oftentimes seek for consistency, resist change. Brief and strategic models, emphasizing results and clinicians taking responsibility for their own failure to progress in treatment. Some of this comes out of the insurance model, that it wasn't enough for therapists to simply merely talk about a client's resistance, right? An addict's resistance. That's an addict being an addict or an alcoholic being an alcoholic. But can we at the same time be critical of our own intervention? Can we see our ineffectiveness? Can we learn to respond in different ways? Can we take responsibility for that? And brief and strategic models emphasize this. These are models that looked at 8 sessions paid for by the IEP or by the insurance company. There was an emphasis on a here and now kind of focus, right? Historically, we were looking at the root, the cause of pathology, of problems, whereas systems theory wanted to talk about, okay, what's happening in the system right now? How can we change it? It really does a lot to mitigate, minimize blame and shame, right? There's this idea of punctuation in systems theory, that you can take a circle or a cycle and arbitrarily you can kind of cut it and pull it apart and create a straight line out of it. But that is just arbitrary, right? Think about the parent-child relationship. One of the things that system theorists have talked about is the impact that certain temperaments and biology have on parents. I talk about it all the time about how parents of the students and clients that we deal with have experienced real trauma and that are apt at times to respond in a trauma-based way, right? It's a trauma response. So we could talk about how the parent impacts the child, but can we talk about, for example, those early places, those early times in parenting where the child's temperament, how easy they are to soothe, how easy they are to accept transitions. Are they colicky? Genetically, do they have some difference with them that might not be a great match for the parent or something that the parent has a hard time adjusting to? And so we talk about parent to child oftentimes, but if we really put the cycle back together and we don't punctuate it, it really is a circular model. Like I said, there's a de-emphasis on the cause and the origin of pathology and more of a discussion about what is maintaining it and what is going on about it. And this was a reaction against psychology because therapists, clinicians saw that while they might have great progress with an individual client or somebody who's been committed, that you reinsert that person back in the old system, whatever the system is, the family system, the cultural system, the community system, and oftentimes there were energies, influences that suggested, that pushed that individual to move back to previous states of unhealth. Individual models tended to look at smaller and smaller, and to observe smaller and smaller aspects, all the way down to the cells and the brain. There was a discussion that the cure and the healthy individual was found inside of the individual. And this idea that we can dissect things down to their smallest parts. Now, as a family therapist, I recognize the value of our understanding of brain functioning. I talk about it all the time, of course. But there's this kind of, at times, there's this limited kind of unilateral idea, for example, that the brain functions in a certain way. There's this idea, people talk about that somebody's chemically imbalanced. Are they chemically depressed? And this may be true, and there may be genetic loading to that, of course, as there is with addiction and other mental illness, mental health issues. Of course there is. And environment impacts brain chemistry. Trauma impacts brain chemistry. Multi-generational trauma impacts the child. So it's not this idea that the brain is just functioning independent of the environment. Like I said, there's a past focus, whereas family systems or systems theory talks about a current focus and a here and now. The primitive intervention, all the way back to electric shocking of clients. And while there are still some approaches today in some very severe and in tangential cases where that can be appropriate. This is a very common and ubiquitous approach in the early days. Asylums, people were put into assignments, and it really was just a housing and medicating environment. There wasn't a lot of therapy going on. And in these early asylums, early mental health hospitals, of which there was many exposés that exposed the abuse and the lack of treatment that was going on, they would treat at times people in groups. And there was group therapy before there was systems theory or family systems theory. But they really weren't talking about the relationship dynamics that were going on between people. In studying systems, this, like I said, is a reaction against the individually focused model. That famous line that talks about, or it's at the heart of general systems theory, which is the whole is greater than the sum of its parts, right? We were moving from this Newtonian idea of simple cause and effect to this quantum physics idea, quantum mathematics idea, that not all things were explained in isolation, right? Things are complex, and they're responding in the context of the system where they might not respond in another environment, in another situation, the exact same way. And then, of course, cybernetics, computers started to teach us about systems. Feedback loops started to teach us about systems. And so general systems theory led to family systems. Going on with general systems theory, the idea of ecosystems. In family systems theory and family therapy, we think about the impact of the culture, right? The impact of the academic setting, the school, the peers, the community. And I think also this is another fantastic way that I think that historically or at times we have this very narrow view that it's merely a parent-child dynamic, right? It's all about the mother, when in fact it's a much more complex system than that. And a lot of the environment, especially as they move into adolescence, right? A lot of the environment is having its impact. You know, look at electronic media. In my youth, in my age, we talked about the impact of magazines and television on children, how it impacted them. And with what's available now in the media, through social media, through electronics, through computers, we can see the rapid impact, information being disseminated to our children, being presented to our children. So think about body image. Think about the messages of low frustration tolerance and delay of gratification that don't get taught. How immediate we need and see the fix in our lives. And how that kind of thinking, that kind of pattern can lead to substance abuse or other self-medicating behaviors. Seeing interaction between society and the family. It's not just the society on the child, but how does the society impact the family? Of course, one of the most common things that parents will tell me so very often is in our culture, in our community, where we live. How can we not feel ashamed? How can we not feel judged? How can we not feel the pressure to fit in these ways, right? The North Shore of Chicago, Palo Alto, West LA, Orange County, the South, New York City, on and on and on. We see the impact of the culture on not just the individual child, but on the family, on the parents, on the entire system. Family systems theory borrowed from general systems theory, a more complex and multidimensional model. One of the things that we also see, we do it in our program. We invite all parents to come out to the workshop that we hold once a month at one of our programs, and we hold multi-family groups so that you can watch other systems. You can start to see other dynamics, and you can start to extrapolate from what you see, what you observe, to what's going on in your family, in your systems. Other origins. One of the origins of family therapy was the Mental Research Institute in Palo Alto, California. This was a group of researchers, of sociologists who were observing families, right? They were going into the homes of families and watching them, more from an anthropological, right, sociological perspective than from a treatment perspective. That wasn't necessarily in the original idea of it all. And then as they start to watch and observe these families, they start to understand something amazing, that it wasn't the stressor, it wasn't the problem. Somebody got ill, somebody lost their job, somebody had a learning difference. And it wasn't those things that predicted or determined whether or not there was going to be a problem in the system. What it was how they viewed it and how they tried to solve it. So they talked about and developed this idea of attempted solutions, right? That the system would try to solve a problem, like somebody having a breakup in the family. And so how they solved it became the problem. So then what they discovered as they started to intervene in these families, is that if they would reframe or change the perspective of the system or the individuals in the systems, then they could access their own resources and be able to solve it. Simple example is, if you reframe pain as not something to avoid, but something that can teach you, that you can learn from, that can be valuable, you automatically become more resourceful and you're able to deal with it. You don't use self-medicating behaviors, for example. This is what I talk about all the time with families. You hear me say this idea that one of the very common ideas or concepts that I work with families is to value the struggle, to value failure, to value the step back, on and on and on. So reframing is a very simple idea that came out of that original model. Another one of the founding places or persons in family therapy who developed a family therapy model called structural family therapy is Salvador Minuchin. And like with a lot of psychological theories, you'll start to recognize some of these concepts in our everyday language. Salvador Minuchin worked at the Philadelphia Child Guidance Clinic. Philadelphia Child Guidance Clinic. He studied families with identified patients who suffered from anorexia and also diabetic families. And he started to observe that blood sugar was being affected by parents arguing, things like that. He started to watch how the system was operating and how it affected the internal workings of one of the children. So he started to surmise something's going on here more than just the disease itself, but something is systemically influencing it. And so he started studying, one of the first people that started studying boundaries, right? Let's talk about the thing that is going on between two people, not the two people themselves, but what's happening between them. That will then become our unit of observation and our unit of intervention. So I'm not going to analyze mom or analyze dad or daughter or son, but I'm going to talk about what's going on between them. I'm going to define that very clearly. And then I'm going to intervene, ask for, give assignments around interacting in a different way. He talked about rules, family rules and roles, and talked about the function of those, and that those ideally changed over time. He came up with this idea that what is healthy, of course, in treating a 5-year-old is not healthy in treating a 15-year-old and a 25-year-old. So health in a family often was defined by its flexibility between children and over time. Not every child was the same. And of course, a 5-year-old is different from a 15-year-old and a 25-year-old. He talked about hierarchy, not as a negative. I think we might think of this next concept of something as something negative or inherently autocratic or authoritarian. But he talked about this idea that parents make decisions, that it's not necessarily a democracy, that it's okay. In fact, he defined the problem at times that when parents didn't assume their proper hierarchical place in the family, when they abdicated their responsibility and brought the child into the executive system, giving them an equal vote, that there began to be problems. So he would reestablish healthy hierarchy. This is apparent, and when I talk about this idea that I spend half of my time asking, encouraging, coaching parents to listen to their children, and you run it through your parent or your adult filter, and then you make a decision based on that. That listening to a child doesn't indicate that you do everything that they say, but that you have empathy, understanding, and patience. You allow it to inform you about what's going on in your child, and then you make the decision within the executive system, which is sometimes a mother and father, sometimes there are step parents involved, sometimes there's a grandparent involved. Temporarily in our program, there's a therapist involved in the executive system. So you make that decision from that place. The risk, of course, with single families or split families is that these hierarchies can be vulnerable. In single families, it can be common, for example, for a child to assume a parental role, to become parentified. So hierarchy is something that we get clear about, we get intentional about. If you're in a single family, that we talk about it more, right? You might be babysitting the younger children while I'm working late tonight, but when I get home, I'm the parent in this system. Executive systems responds to anybody in the parental system, parenting system. So, like I said, when allowed, when invited, grandparents, step parents, of course, therapists, others, teachers can be a part of that system. It's not the same as when a grandparent comes in or an uncle and an aunt come in and usurp the executive system, right? Sabotage it. They participate in an uninvited, unintentional, unwelcomed way. Mnuchin talked about alliances, right? Mom and dad create alliances against somebody else, or mom and daughter against dad, or the two children against the third sibling, on and on and on. Are there alliances, and are they healthy alliances? Are they appropriate? Do they cross generational lines? Right? An alliance with mom and dad is appropriate. An alliance of mother and daughter against dad would not be appropriate in most or nearly all cases. Coalitions, of course, is more about somebody against somebody else. Very similar to alliances, but it's definitely centered on being against somebody else. And then the intergenerational violations of it. Another pioneer, Murray Bowen. And these are two of the principal ones that I often lean on and talk about in my work. Murray Bowen was a medical doctor in Washington, D.C., and he was teaching psychiatry, teaching his psychiatric students about therapy. And he was observing the changes as he would practice supervision with them and he would teach them. He was observing the changes that would occur. And then during semester breaks or visits home, he could watch and see how they responded. When they came back, what kind of reports did they give? What was going on? So he started to develop several ideas, one of which was triangles. Bowen's idea is that the most stable structure in the family is a triangle. And that is because in a triangle, you're not dealing with a dyad, with two people. Right? That's a vulnerable structure. Me and you. There's divorce all over the place. Right? But if we can triangulate or bring a child into this, then we can diffuse the tension, the anxiety, the anger, the angst between us onto the child. Right? You bring in a third person. It's what happens when we talk about somebody else. We triangulate. Right? It's really hard for you to talk to me about how you feel about me. It's a lot easier for you to talk to me about how you feel about our cousin or our child or our ex-wife. Right? That's a lot easier. And we even imagine sometimes that we're doing something authentic or courageous in it, right? When we're talking or confronting somebody else to somebody else, talking about somebody else to somebody else. But the hardest work of all, even in therapy, is to talk directly to somebody. So triangulation or triangles was something that Bowen talked about, created stability in a family, but also prevent intimacy and healthy relationships. Oftentimes, a classic triangulation is a parent with another parent and a child. So the child develops the symptoms, and the parents might have differences, but they don't have to work those out because they can take their angst, anxiety, frustration out on the child. And the child is willing to step into that role to stabilize the relationship, the marriage. That's why not a lot of the majority, but much of our work as family therapists is saying, is this a marital issue? And can we deal with that? Or is this a parenting issue? Because those are two different things. And if the marital issue is being worked out in the parenting or in the child, then it's not being worked out in the correct place. He talked about differentiation as continuum. I'm going to table that for just a moment. He talked about family ego mass, this idea that families have a certain comfortability with proximity and intimacy, right? He might have rated them on a 0 to 100 scale. So if you come from a family that's about a 60, you're going to be attracted to people that are somewhere between 50 and 70, 55 and 65, right? If you're 70, you're not going to be very compatible with a 50. And if you're 50, you're not going to be very compatible with a 70. It won't make sense to you, right? The 70 will see the 50 as emotional and reactive and a mess. And the 50 will see the 70 as cold and detached and uncaring. And we can move out of our family's number. We can move with a lot of therapy, with a lot of work, sometimes triggered by trauma or difficulties. So this idea that Bowen had was, the idea that you marry your parents. He was saying you don't marry your parents, of course, in a way that it's like your mom or like your dad, but you marry your parents in the same way that you would say you marry somebody that speaks the same intimacy language that you do, right? And it's much less visible than where mom and dad work, right? How mom looked, how dad looked, what was their background. It's more complex, more subtle than that. So family ego mass was this kind of idea that the family operated in a certain level, certain proximal way, right? That their intimacy was measured in this way, and that anxiety was an important part of Bowen's model. I've told this story before, but I remember in my early training in family therapy and family systems theory, we were looking at a model, and they were describing, this is this 4-quadrant model, and this is kind of what happens in the various types of families, if we could kind of separate them into these 4 basic types. And then we turned the page, literally in the textbook, and then they said, but if there's a lot of anxiety in this family, none of that matters. That overshadows everything. And I remember thinking to myself, I was young, and I was thinking, what would be the big deal? Why is anxiety such a powerful feature that it could erase the rest of this model? But now, and working, of course, as a parent, and working in the years that I've worked as a therapist in wilderness therapy, you can see the effects of anxiety, how debilitating it is, how it leads to control, how fear leads to kind of power and control and avoidance and self-medicating and other issues in the family. Bowen talked about intergenerational transmission of pathology. He wasn't the only one, but he was one of the early family therapists that talked about this, right? That if you have a parent, for example, that went through the Holocaust, there are going to be certain experiences, certain brain structures that are going to affect the way that they behave, the way that they bond, the way that they attach. And that's going to affect you, and so forth and so on. We look at race in this country, right? And there's this idea that sometimes today there's no race or no racial issues. But that stuff that has happened hundreds, 200, 300 years ago, 50 years ago, has an impact today on the individuals who are parents and on their children. It gets transmitted. Bowen talked about assertive communication. He has a couple of famous stories where he sent a letter before a family reunion to all of his relatives talking about all the family secrets. And how absolutely, of course, that upset everybody. But it changed the way that the family related to each other. He talked about one time when his mother or his father, I can't remember which, called him to complain about the other. And he hung up, let's say, with his father. He hung up the phone with his father, and then he called his mother back and said, "Your husband was complaining to me about something you did. You probably should talk to him and deal with that." Of course, the result of that is that people don't want to talk to you anymore. So Bowen got himself out of the triangle, put the parents back in the more difficult position of having to deal in a dyad. Something that Bowen did that was interesting, as one of the founders, one of the parents of family therapy, I think it relates so much to what we do. He never did therapy with two people at the same time. So while his unit of observation was what was going on in a family system, his intervention was with an individual and the assignments that he made to change. And I think that's a really good idea and concept that can help support and underscore what we do in wilderness therapy. I don't hear it as much as I did many years ago, but people talk early in the early years about if you're a family therapist and if the issues are embedded in the family, oftentimes this would come from the children, but sometimes from loving parents who are grieving the loss of their child, then why not put the child back in the family, treat the family in vivo? And I've talked about this idea from a Bowenian perspective for years, that the initial pulling apart of the family, right, sending the child to wilderness therapy by themselves, the distance, the fact that we start off with letter writing, moving sometimes, most of the time, to phone calls and then visits and then transition. That external structure is a great example of a Bowenian concept that first let's understand what's going on with you in the relationship. And we can best do that by talking to you individually. We're still going to talk about mom and dad. We're still going to talk about your child, the stuff that's going on in between, but I want to hear it from you. I want you to get clear about it, become more differentiated. And then we're going to put you back together. It's one of the benefits of letter writing therapy is it's so slow, so deliberate, that you can really identify, analyze, intervene in and around the letters. Because it's not moving too fast. You can take a day or two or three to respond. You can write a draft. And it's practice, right? It's a kind of dress rehearsal for the real thing later on. Here's a model for comparing Bowen and Mnuchin and the idea of boundaries. Both of them talked about what went on between people, amongst people in a family. And Mnuchin had this idea. He identified this kind of continuum. On one end of the continuum, he talked about rigid boundaries where things wouldn't get through, right? Feelings wouldn't get through. Communication didn't get through. There was distance. And in the middle, he called them clear boundaries. And on the other end of the continuum, he called them the diffuse boundaries. If your family or if your relationship had diffuse boundaries, you were enmeshed, you were overlapped, right? Reactive, dependent, that sort of thing. If you had rigid boundaries, you were disengaged, right? I think one of the American solutions to problems in a family of origin is to just move away, right? This idea that we're too reactive, we're too dependent, we're too emotionally volatile. We fight, we react to each other. And so my solution is I'm going to move from Los Angeles to Washington, D.C., and that will solve the problem. I'm not going to see my parents, and that will solve the problem. It does temporarily, of course, like sending your child to wilderness, quiet things down. But if one doesn't do the work, one doesn't really change that stuff that they carry around with them. It's going to lead to a similar type of engagement relationship. So that was Mnuchin's idea, Salvador Mnuchin's idea. Bowen came along. He was about at the same time. It wasn't like he came along and challenged Mnuchin, but he was in a different place, presenting a different way. And he said it this way. He said, this continuum that I see, he said, on one end, we'll call it undifferentiated. And on the other end, and he put an arrow on the other end. We'll call that the differentiation end. He put it as an arrow because he said there was probably nobody that was perfectly differentiated. But if we can imagine a theoretical 100, it would be between 0 and 100. And what he said was that cutoff, which is like disengaged, and fusion, which is like enmeshed, are not opposite of each other. They're just stylistically different. I remember saying years ago to a young woman when she was describing her father and her fear about his reaction to her thoughts around drugs and alcohol as she was graduating from the program. And she was afraid he was going to shut down and not listen to her, which he actually eventually did. But I said to her prior to her visit with him, I said, so your dad is very fragile. And she said, I don't know what you heard, but my dad is not fragile at all. My dad is tough. He's like a rock. He's rigid, right? He's too strong, if you will. And I said, no, it's not, a rigid thing will break. It can't bend. He doesn't have flexibility. He's fragile, like glass. There's no bend in it, right? She was mistaking because the style looked masculine and angry. She was mistaking that for the opposite of vulnerable, the opposite of fragile, right? We sometimes look at this style, right, of being reactive, of being enmeshed, and we think that's the opposite of this disengaged style. And this in the middle where there's two people connected, communicating, talking, feeling, but moving separately. But this and this are just stylistically different, but essentially just the same, according to Bowen. And so when we get and develop greater differentiation, intrapsychic differentiation, which means knowing ourselves, we can develop greater interpersonal differentiation, which is knowing where I start and you stop. When you have a feeling, it's not mine, but I can hear it and be present with it and sit with it. This father could not sit and listen to his daughter's feelings and thoughts and wishes and drives around alcohol and drugs. He had to cut off. He didn't have the capacity to sit and to listen, to understand, and to see her. And of course, the risk is on the other style that if you understand so much and are so compromised by that understanding that you have to give in to the child and give them what they want, right? That's the other style. Can't hold a boundary. Feel guilty. Enable. Give in. So forth and so on. Other contributors, the brief therapy model, Jay Haley, out of and his group he was both in Palo Alto and he was also in Arizona. This idea that they could look at a simple stepwise model of therapy in 8 to 10 sessions, and if it wasn't effective, then the therapist was doing something wrong. Narrative therapy, telling your story, rewriting your story, has an influence and a contribution to family systems theory. Functional family therapy, looking at the function of the symptom, looking at the roles in the family. It's another model. The Milan School, we borrowed the Milan School, one of their interventions, where the clients would listen to the treatment team talk about them while they were standing behind a one-way mirror, which is the Milan group that we run every Tuesday in our program, where the clients get to watch the staff, the ingoing and the outgoing staff, talk about them, so it's all transparent. The addiction and support models for alcoholics and drug addicts, the Al-Anon model, has its contribution. It also speaks to the intervention idea, right? The interventionists and their ideas around interrupting a systemic addiction in order to get both the identified patient and the family into treatment. Experiential models, symbolic approaches. Virginia Satir, Whitaker, right? Other kinds of experiential activities. Birth order studies. One thing I found fascinating with birth order studies and studying in college was that firstborns in a family were much more likely to have similar personality traits many times than family. That's a powerful contribution to this, right? If we can look at firstborns, secondborns, thirdborns, middle children, last children across our society and see some similarities, some significant trends amongst the firstborns, the secondborns, and so on, then what that tells us is that systems theory has an impact. This is not a nature versus nurture discussion necessarily. It is a nature and nurture discussion. Let's understand both. Anthropology, of course, like I talked about, had its influence, observing families and systems and culture, and then life cycles theories, watching how people develop and having that inform us to how to analyze, identify pathology and health in individuals and in a family. Something that all these models share in family therapy is the pathology and health is embedded in the system. And the focus of intervention and change happens in relationships rather than the individual. Changing relationships is often more effective than sustaining than merely treating the individual. I've always thought that and that's one of the differences that we wanted to make. When I started in wilderness therapy over 20 years ago, family therapy, family work wasn't done. People had such confidence in wilderness therapy and saw such dramatic impact and results that they said, we don't need the family. And besides, because of the family's resistance and shame to participating in therapy, it's too much work. I was even told that when I started. But I'd been trained in all of this model, and so I came into it. And then when we started ours in 1998, our idea was we're going to involve the families right away. And what we saw was similar results during the process, but giving the family tools so that they could sustain the changes later. That's why we give these broadcasts, these webinars and podcasts for life. That's why we host parent support groups across the country forever. Because we want to continue to support families in the process. Some other principles. Homeostasis, that is a change back energy, back to the status quo. So just prepare yourself that when you change, and be aware that even when your child changes, that there's a tendency towards moving things back to the way that they were, even when that change is healthy, right? We can all, if we're reflective and open enough, we can all even see our own homeostatic energy. Attempted solution sequences is this idea that all the crazy things that a family or an individual in a family do, all that they do, is they're trying to solve the problem. But that attempted solution becomes the problem, right? Taking opiates becomes the problem very quickly. Cutting on yourself is the problem very quickly. Avoiding school is the problem very quickly. All of those things, behaviors, are an attempt to solve the problem, most likely of pain or anxiety. But they themselves become the problem. So learning to disrupt and change the system, wilderness therapy does that very well. And learning to reframe. That's why you'll notice that your evoke therapist spends a lot of time on the phone explaining your child to you, kind of giving you a perspective. And when that frame can change, then you have resources that can come into play that can help. It's the concept that I've taught you before, where I talk about this idea that the job of a therapist is to find the story, in our case, in the child. Find the child's story, help them to tell it, or tell it for them. And the story does a couple of things. It explains everything that they're doing. Every crazy, odd, irrational thing that they're doing. Because in some context, if we can find it, all of that makes sense. It has to. And it does a second thing that's very important. The story asks certain things of others in the family, or society, or culture, or system. With learning differences, it asks for different accommodations. With other acting out or acting in behaviors, it asks for a different kind of response than the parents. Sometimes a non-intuitive response. Understanding the function of the symptom is similar to the attempted solution sequence, and that is that every symptom serves its function. One of the assignments that we give to the clients is write a function of the symptom paper. Right? Tell us why your depression helps you, how it helps you, how does it serve you? How does your aggression, your sexual acting out, your school avoidance, how does it serve you? You're fighting with your parents. How does that serve you? Or what does it serve in the system? Understanding the identified patient is just that. Really, we're identifying families that are struggling or have issues, difficulties, that are broken. The identified patient is just the lightning rod, the flag, if you will, that the family is flying. Identifying roles, rules, and patterns in families, right? Part of therapy is you're joining a new context, right? You're not in the context that you grew up in. Ideally, therapy is a different kind of context. Ideally, the therapist does not recreate the system, like our program does not recreate the wounds of childhood, the challenges of childhood, the deficits of childhood, right? Ideally. And what it also does is, because you're in a different context, you can see your old context more clearly. You can look back and say, what I learned in my family, what we thought, what we believed in our family, the way that we were, wasn't the truth. It wasn't normal, right? There's no normal family. It was just a contrived context that my parents brought from their context, and so on and so forth. So getting out of your context is one of the most effective ways, perhaps the only way, to really ever see your context. Enactment is kind of an assignment. Like when we ask you to say it differently to your children in a letter or on a phone call, your child's going to try to guilt you. Your child's going to blame you or vent at you. Let's ask you to do it differently. Can you say it differently? That's an enactment. Isomorphism is a concept where it's a pattern or a behavioral cycle that indicates a structure. In other words, if a father, for example, like the one I gave earlier, if he shuts down when his daughter shares her feelings about drugs and alcohol, that's one cycle of behavior. But is that an isomorphism? Does that give us an example of the way this family is structured? Do they have very closed communication? Are there rigid boundaries in this family? Is there low differentiation in this family? What does this behavioral pattern or example of behaviors teach us about the structure? That's an isomorphism. Rituals are what we do, of course. Family rituals are sometimes conscious, sometimes unconscious, right? Family vacations, family dinner. What are the morning routines like? Some of those are very explicit, and some of those are just patterns that we get into. And then experiential therapy. What's great about wilderness therapy is that the group becomes this microcosm. And it really does work nearly every time, where we can spend some time watching your child. And of course, not everybody in the group is like everybody in their family, but we see how they react live, right? We can intervene, we can watch, we can observe, we can do all of that live. And it's harder to hide in experiential therapy because it's easy for many people to kind of verbally hide, to avoid, to rationalize. But when you see it in real time, it can be very, very powerful. Solution-focused therapy or principles is this idea that it's a strength-based approach. You know, what has worked for you? What resources have you used? What strengths do you have? Solution-focused, strength-based approaches tend to focus on resources and not deficits. Paradoxical interventions are, especially with anxiety issues, are really fantastic. For example, with panic attacks or anxiety attacks, one very effective paradoxical intervention is to assign the individual to have more and to coach the system or the family to allow it and to encourage it, to be okay with it. Because it's hard to have an anxiety attack or a panic attack when you're trying to have one. And when people or you are trying to stop it, it exacerbates it. It's like reverse psychology. But you can also intervene in a family system by encouraging somebody to act more depressed. See how that goes. Encouraging a family member to be more enabling. See how that goes. Punctuation, I described that earlier. It's the arbitrary cutting apart of a cycle or a circle and putting in a beginning and an end on it. Equal potentiality is a concept that oftentimes from very different starting points comes the same end. And equal finality is that sometimes things can start the same and end very different. So the idea is that you can come from an abusive family or what really nurturing family and end up to be a social worker, or you can be raised in the home of very kind people, and one child can end up with a lot of pathology and issues, and one child can end up very healthy and well adjusted. Some of you have that story in your family. Family systems theory does not place a great deal of energy into discovering the etiology of problems or the cause of problems. Family system theory focuses on what is reinforcing and maintaining the dance. De-emphasizing blame, family systems therapy is forward thinking. Family systems theory looks at all the influences on a system and its parts. The child may have as much impact on the parent's behavior as is the reverse. So what does this do for us? It reduces shame and focuses on solutions. You'll recognize that in your family therapy sessions. It can create dynamic change, not just lasting change, but dynamic change. And of course, we intervene in this on the system in order to create energy or patterns or roles or rules to sustain changes, and so that the homeostatic mechanisms are altered, are mitigated. The therapist can't simply blame a lack of progress on the client, but must own and evaluate the self-centered approach. And I've heard that for many years. Just because of the insidiousness of an eating disorder or an addiction, for example, just because it's so insidious, it doesn't remove the responsibility of the therapist to practice self-evaluation, to look at their own issues, their own countertransference. And then, of course, I think for families, it's a very comforting thing to look at the ecosystem, what's going on in the culture, and not just the internal system itself. We recently had a family session with our son where where the issue of how much he hated one of our employees who works for us at home came up. The therapist pointed out that this was triangulation. Our son was open to receiving the concept, but it didn't seem to really sink in. We have no further sessions for now. How can we bring this up further directly with our son to address the concept of triangulation? The best way to intervene with triangulation is to not participate in it. But most of us are so tempted, so lured into focusing on triangulation. I had a situation with my children last night where they were in conflict, my adult children. And at different times, they came to me last evening, about an hour or two apart, they were visiting, and they shared with me something with the other. And I listened and didn't say anything. And at one point, there was a question about if the other one had said something, and I said, I won't participate in talking to you about that. So the best way to do it is you can listen, but essentially give nothing back and require the person to go back to the original person to deal with it. Right? Sounds like you have a problem with your father. Sounds like you have a problem with Joe or Joan or whomever. And I'm sorry that sounds hard. But to too intensely kind of absorb and validate that reduces the anxiety in them temporarily, which is what the lure is, but doesn't help them develop the skills necessary to work on relationships in a healthy way. Next question. Brad, I attended your intensive last month. I wanted to thank you for helping me recognize the dysfunction in my family system of origin. I've been influenced by guilt and the fear of disappointing others. It led me to dilute my own truth and let my boundaries go. I have been doing my own work, as you know, while my older son is currently at an RTC, a residential treatment center, post-evoke. I have found the courage to confront my mother, who manipulates with guilt and has been pushing hard to come to stay with us for a visit at a very challenging time for my immediate family. I chose, quote unquote, how to lose and managed to have the capacity to deal with the discomfort of her disappointment. Because I held my boundaries and told her not to come. I'm happy to say that I'm currently in Asia traveling with my husband and younger son. It has been a great adventure and a renewing experience for me. Wonderful story. Thank you for sharing that. The choose to lose, how to lose idea is that when clients come to me with a dilemma in a relationship, I quickly become aware they could have figured it out themselves if there was a way to win, but there's not a way to win, and so you get to choose how to lose. You don't get to win. So thank you for sharing that success story for today. I appreciate that. All right. We ask all families to go to 6 12-step support groups while they're with us, either Al-Anon, CODA, or Families Anonymous. So you can go to their websites to find information and meetings in your area. You can also go to nami.org, and there you can find classes and resources in your area. You can listen to these webinars on podcasts. The podcasts are available to the public. They are not live. They're usually posted the night or the day after. If you have an iPhone or an iOS device, you can go to the podcast app and search Evoke Therapy Programs. On Android devices, download the SoundCloud app and search Evoke Therapy Programs. On Twitter and Instagram, follow us at Evoke Therapy. And on Facebook, you can search Evoke Therapy Programs. You can also find the Second Nature Alumni Foundation on Facebook by searching it there. That is a program for people, an organization for people, alumni families, to help people who can't afford treatment. You can, of course, also go to our blog. My book, The Journey of the Heroic Parent, is available on Amazon. On BarnesandNoble.com right now. Amazon is temporarily out of stock. It'll be back in stock soon. You can also get an audio copy through Audible or a CD purchase on Amazon. You can also go to the Parent Alumni Foundation book page where therapists from Evoke have recommended books and readings on various topics. And if you buy the books there, a percentage of the proceeds, go to the alumni organization to help people who can't afford therapy. All right, upcoming parent support groups: New York City on September 13th, 6:30 to 8:30. Los Angeles area in Studio City on the 24th of September. It's a Sunday meeting again, 4 o'clock potluck, 5 to 7 meeting. Nashville, Thursday, August 31st, 6:30 to 8:30 p.m. Chicago, Toronto, to be announced. And then in Washington, D.C., we don't know what night yet, but it will be during the week of the Wilderness Play while it plays at the Kennedy Center in Washington, D.C., sometime around the October 10th to the 13th. Our intensives and workshops, we have a couple of spots left in Toronto. So if you're in the Northeast or in Toronto, encourage you to sign up for that, August 22nd through 25th. The Finding You workshop is an intensive workshop, 6 or 7 individuals, family of origin work, finding yourself. You just heard somebody comment on their own experience. And then we'll be back in Utah in September. We ask all families to go to a workshop while they're with us. You can combine that with a field visit if your therapist says it's appropriate. You can also schedule private family intensives or pursuits program. Pursuits are our high adventure programs. In fact, there's a pursuits trip going on this week for a couple of weeks to Nepal. It's full up. Any other questions before we close? One more question. My son is coming home after being away from home for 9 months. He says he is very independent. He does not want to stay at home, although we have communicated often. Some of our conversations have been uncomfortable, but he wants to stay with a family member and visit us. I feel very emotionally confused by this. It's a great question. It's a great point. This would be one of those things. It's not inherently unhealthy that he doesn't want to live with you. It also depends his age. If he's a young adult, that might be his physical way of keeping the differentiation, right? Like I've been explaining. It might help him to feel more safe and clear. I've told the story that when my son went away for a couple of years, moved away, just before we took him to the airport, just before that, I was getting very emotional in my therapy session on a Friday. And my therapist says, I was talking about how much I love my son, my firstborn son, and could he understand ever how much I loved him? And my therapist reassured me. He said he knows exactly how much you love him. And I thought that makes sense. He knows by my behavior, by everything that I've done, exactly how much I love him. And then he said, and he needs to get as far away from you as you can. And I laughed, and immediately the pain was gone because I realized that's the thing. Like, he needs this journey. And so my idea is honor his independence as much as possible, and that will be the most effective tool at becoming close to him. I hope that makes sense. Somebody's asking about the Bay Area parent group. We will schedule that soon. I had to change it because of some personal issues. It was going to be the day after the LA meeting, but we have to change it. So I'll get that on the calendar ASAP. Hopefully I'll have it on the calendar by Wednesday. All right, we're going to do another webinar this week on Wednesday, August 16th at 7 p.m. Mountain Time. Don't know the topic. I'll decide that tomorrow. Any topics are welcome. Any suggestions are welcome. You can email us at webinar@evoketherapy.com, and we'll be happy to look at that. All right, folks. Have a great evening. I hope these points of contact are helpful. Take care, and I'll talk to you soon. Bye-bye.